Welcome back. So this morning I've got, so first of all, her name is a mouthful. Her profession is something I've never seen or heard before. And so this morning we'll get a little insight. So I'm going to be talking to Imputu Pius. Got the name right?
Yeah, you did.
First of all. And then she is a medical geneticist. What is that?
Yeah, so a medical geneticist is someone who uses genetics to sort of, within the healthcare profession. So first of all, to break it down, every human is made up of cells. That's basic biology. Okay. And cells are powered by genes. So genes are just those molecules in your body that have the information to make you who you are.
Okay.
Exactly. So that's the easiest way to break it down. It's like when they say the basic unit of life is the atom, something like that. Okay. So genes are like the atom of the human body.
Okay.
And so, so a geneticist is someone who studies genes, how they interact, how they work, how they express, meaning how they make us who we are.
Okay.
So genetics, so genes, any living thing has genes. Plants, animals, humans have genes. So if you are a person who studies genes in the context of the medical setting, then you're a medical geneticist. Okay. So if you study how genes cause diseases, for example, then you're a medical geneticist.
Okay.
Exactly.
Okay. And so if we're talking about breast cancer, it's really right that I talk to somebody who understands genes. Is this to say that it's some sort of a genetic illness? So,
you know, breast cancer is caused by, or it doesn't have one cause, but breast cancer is a phenomenon that is best described as an abnormal growth of breast cells. So, and like I said, cells are, there's genes behind every cell.
Okay.
So to understand how breast cancer works and how to diagnose it, you need to understand what genes are behind it. Okay. So that's exactly how medical genetics ties into breast cancer.
Okay, exactly. Okay. Yeah. Well, knowing this, let me take you a little bit out of your comfort zone. Yeah. I mean, what are some of the unthinkable myths you might have heard about breast cancer?
Yeah, I think the most popular one is that it's a white man's disease. Yeah, it's like, oh, it doesn't happen to us in Africa. Okay. It's a white man's disease. But that's not exactly true. In fact, there is the most dangerous form of breast cancer is the one that affects African-American women. Really? It's called triple negative breast cancer. So you would imagine that for a disease that is a white man's disease, that myth is so untrue.
I see.
Yeah, but it's also the myth that, oh, it's just for older women, you know, when I'm 70, I'll start worrying about it. Again, not true. Okay. Triple negative breast cancer affects mostly women who are under 40. So that itself is a risk factor for triple negative breast cancer.
Okay.
Yeah.
It's a good time to ask somebody who studied genes very much that what is breast cancer? Oh, yes. I mean, the biggest question. I know you've heard it a lot of times, but this time around I'm talking to somebody who's done a lot of research.
Yeah, so breast cancer, the way that we physically understand it is an abnormal growth of the breast. Sometimes it's one, sometimes it's both. But that abnormal feature you see where the breast starts to, maybe there's a lump. For most people, it's a lump. For most people, it's an abnormal flaky around the skin, a dimpling, inversion of the nipples, etc. That is what breast cancer is physically. But behind all of that is interactions that are going on. So essentially, like I said, the human body is made up of cells. Your arm is like this because you have cells that have been given a command to only divide to a certain extent. Okay. So your arm is made up of millions of cells, and that's how you have your arm like this. Your breast is the way it is, the shape it is, as small or as big as it is, because your body has already received a command from your genes for your cells to only divide to a certain extent. Okay. If for any reason at all, the cells lose that command, the stop dividing signal, then your breast cells just keep dividing. Wow. And that's what causes cancer. So it just keeps dividing. It doesn't understand stop dividing. And that's how you have the breast enlarged as a physical feature of breast cancer. But also, it's important to also understand that even though, and that's why they always say men can also have breast cancer. I think that's also something that we should be talking about. Because sometimes the subdividing signal means that when it divides and the breast area can no longer house it, the cells migrate, what we call metastasize, to other organs of the body. And that's what makes breast cancer very lethal, when it metastasizes to organs that are very delicate. Okay. Yeah. All right.
Now, let's talk about symptoms before we even come back to risk factors and all of that. Typically, a person who's developing or who's developed breast cancer, what are some of the things I can see or know?
So for most breast cancers, the typical sign is a lump. So you would find a lump in the breast, but also some other not very typical symptoms you would find. Things like dimpling, So dimpling is like, if you see someone with a dimple cheek, you know, that small insertion. Some people with breast cancer start to find a dimpling in one or both breasts. Some other people find like redness, unusual redness in a particular spot on the breast. For some other people, one of the nipples starts to invert, so turn inward. And when you know that that's not normally what your nipple looks like, then it's important to talk to your doctor. So breast cancer has a lot of physical signs. But I think it's also important to mention that not all breast cancers have those signs. And that is what is tricky. For most people, they don't see those typical physical signs until it's probably at very advanced stages. So that's some of the symptoms.
So, okay, you've just said stages. Does this to mean that they come in stages?
They do.
You want to walk us through it?
Yeah, so typically breast cancer, like most cancers, is stage 1 to stage 4. The gradation of stages is from when it is less, what's the word to use? When it's less, when it's easiest to treat,
okay,
to when it's hardest.
Okay.
So what it simply means is, from stage 1, we're talking about when maybe it's still very local. By local, it means it's still in the region where it started. It's still within the breast tissues. It hasn't spread. After a while, the cancer can spread into the lymph nodes, that's spreading towards the areas around the breast. We call that regional. But also sometimes it can spread to distant sites. So it can move through the blood or through lymph tissue into to other organs. And that is what we call distant. By the time cancer becomes distant, we're talking stage 4.
Okay.
At that point, it's most likely very difficult to treat. Because it's going to maybe lodge in some organ where touch it and it's touch and go. So, yeah.
Okay, let's go back to the conversation on the genes. Yeah. Is it to say that if my mother had breast cancer before, or I've got a relative very close or even long distance, is it to say that it's possible that I can have breast cancer as well?
Yes, there's a possibility. There's several risk factors that can predispose a person to cancer of any kind, but breast cancer in particular. It's not one or the other thing. I think it's important to say that it's a probability, yeah? Okay. Some people have certain risk factors but never develop breast cancer in their life. Some people have the risk factors and unexpectedly develop it sometime in their life. One of the risk factors is possession of certain genes that can then mean that in your lifetime you will have it. So one of 2 typical genes are called the breast cancer gene 1, BRCA1, and the breast cancer gene 2, BRCA2. If your mother or your sister has had breast cancer, usually your doctor, if you talk to them, would advise you to go for breast cancer screening and test to check if you have either of BRCA1 or BRCA2 genes. Because these genes from research have been shown to increase a woman's susceptibility to breast cancer. And very oftentimes it may be that you inherited the mutation from your mother or someone in your family lineage. So it's always important to check. Yeah.
Okay, so it means that now I may not be developing any symptoms or anything, but I just want to have a clear mind, and so I can just walk to the hospital and ask that I want to check if there's a possibility of me getting it.
Yes, the genetic test for the BRCA1 or BRCA2 genes, so you can request to have that check done. And then if you have any of one or both of those genes, then what a doctor would recommend is a regular screening to see if you've developed breast cancer at any point in your life.
Okay, so even if I go to check and yes, there's a gene that makes you susceptible to it, it means that you cannot even start treatment until you've started developing it?
No, not likely. I mean, treatment is for something that exists. Exactly. What most people tend to do though is to try and prevent. So you know the Angelina Jolie story, she's a huge ambassador for breast cancer because she found her mother she had this breast cancer in her family, so she did a preventative mastectomy, which means she took out her breast. So people can do a preventative mastectomy or a preventative oophorectomy. That means removing the ovaries, because breast cancer and ovarian cancer are very linked. Okay. So having BRCA1 or BRCA2 genes predispose you to either or breast and ovarian cancer. So some people opt to remove the breast or the ovaries if they have the genes, because the truth is, if you have the genes, the cells that will start forming the cancer are in the breast. So if someone has the genes and decides to remove the breast, it means the cells do not get the chance to form in their lifetime. It's a hard decision, but some people make it.
Breast or ovaries?
Yes.
Breast or ovaries? Which one would you take out? Your breast or the ovaries? My goodness. Anyway, let's tone down the conversation and make it a bit easy for people to understand.
Yeah.
Say you're afraid. I mean, no need to be afraid anyway, but you want to be sure that you're on top of your information. You want to be self-aware.
Yeah.
Let's talk. I hear the self-examination.
Yes.
You want to help us understand what self-examination is and what it looks like?
Yes. So essentially self-examination is checking the breast physically to try and find if there's any abnormalities. So as a woman, you understand your breast. You know what it usually would look like, know what you usually feel like. And so self-examination just means that you just check very often to see what is there any difference that I'm seeing. Some people say, oh, we check for lumps, but it's important to note that not just lumps. Lumps are the most frequent initial symptom of cancer, but you should also be checking, are you finding flaking around the breast?
What exactly do you mean by flaking?
So flaking, you know when you feel like your skin is peeling, drying up and peeling, that's what flaking means. So if you're finding that kind of thing, or unusual redness that you cannot explain, or dimpling, like, you know, when if you do this and it, you know, you can feel a hole, for lack of a better way to express. You just see that without any provocation. Then you should be. So examination just means physically looking at it, touching it, being friendly with your breast. I think that's the best way to put it. Because one of the myths that people have is, oh, I can't touch. I shouldn't be touching my breast.
My own breast, though.
Yeah, because it's sexually, I don't know, provocative.
Even for your own self.
Exactly. Yeah. Exactly. I think it's important that we debunk that myth. It is your breast. You should be very comfortable with it. You should be able to understand it. You should be comfortable with touching your breast, any part of it you want, you know, so that you understand when something isn't right. But also if you have a partner, that partner can help you check, you know, can help you look around, feel it, palpate, so that if anything is not right, then, you know.
I'm really wondering how a partner can understand your breast better than yourself.
But I think that's part of breast cancer awareness. I think it's important to put it out there. But breast cancer awareness is not just for women.
True.
Yeah, so partners should also be should be partners in breast cancer awareness, you know. If you're with your partner, you feel something isn't right, you should tell them, I think something is not right. I think you should have that checked.
Okay, I know that this might sound quite hilarious, but it's mostly on social media. People will send it via WhatsApp groups and all of that and say that, oh, if you allow your breast to be touched, it's morning television though, but unfortunately we have to talk about this. So either you allow your breast to be sucked frequently or to be touched frequently, it makes you not, you know, susceptible to breast cancer. Is this true, or we should just debunk it right here on live television?
Well, there's no scientific research in my experience to prove what is proved that. But I think to link that, it's been said that women who have had children, 1 or 2 children, especially maybe earlier than 30, are less likely to have breast cancer. So I'm not sure there's a relationship to the question you've asked, but that has been in research. But again, it's one of those risk factors where some people have those, you know, some people have those I don't know, those features, but may still go ahead and develop cancer or not. So yeah. So
risk factors, would age be a factor?
Yes, age is a factor. Typically, for most breast cancers are expected to start above 60. But like I said before, there are certain kinds of cancer that start really early. We call that phenomenon early onset breast cancer. So triple negative breast cancer, like I said, classically starts, so women younger than 40 are very, very highly likely to have triple negative breast cancer. Another risk factor for triple negative breast cancer is being African American. So, you know, being a black woman essentially makes you many times more likely to have triple negative breast cancer.
Wow.
Yeah.
Wow, that's strange.
Yeah.
Okay, so earlier we mentioned that the month of October, we take a lot of time talking about breast cancer. We create a lot of awareness, and we chose the color pink. It's very girly, so that would have your full attention. And so get a touch of pink at some point, or learn a thing or two about breast cancer. Educate yourself. I mean, you heard Mputu saying it. She says that you can be a man and still have breast cancer. Let's take a moment to talk about it and how this may even develop, how common it is. But just know that you should be able to learn a thing or two, so that you can teach your friend, your sister, your mother, a relative, whichever way, okay? Now for the men, how would theirs typically start?
So I think it's important to mention that sometimes you have primary cancer and secondary cancer. So primary cancer just simply means that the cancer expresses in the region where it started. So for example, cancer starts in the breast and then it shows up as a lump. That's a primary cancer. But sometimes cancer can start somewhere and then metastasize. By that we mean migrate to other parts of the body. So men can have cancer that starts in the breast and then shows up somewhere else. Liver, kidney, wherever else it pleases. We never know where it will show up or where it chooses to migrate through the system.
Cancer.
So, yeah, so the reason why it looks like men don't have breast cancer is because for it to express, it needs the glands, the tissues, exactly. So for women, it typically expresses in the breast, but it doesn't mean that for men, breast cancer cannot start in the breast.
Okay, what's the survival rate for a woman? I mean,
so with increase in medical advances, we're having better prognosis, we have better survival, chances these days. But unfortunately, for things like triple-negative breast cancer, the prognosis is still very bad. For triple-negative breast cancer, for example, a woman would typically survive 5 years, for 5 years, but after that, it's very dicey. And the reason, I think some people may say, but why? Why is it that bad? So you see, when at the genetic level, when you have breast cancer, what happens is you have something called estrogen and progesterone receptors on the cells. What that means is the hormones that make us female, that make us express the female characteristics, are largely estrogen and progesterone. So most people would be able to remember that from biology if you've done any kind of biology. I'm sorry. Yeah, but it's just important to know that the hormones called estrogen and progesterone make us largely feminine. So, but people who have breast cancer express the receptors for these hormones on the cells, on the breast cells. There's also another hormone, another protein that is a mouthful, but for short it's called HER2. So when someone has breast cancer, they express these receptors on the cell, and that is what is the target for treatment.
Okay.
So the medication that is given to treat breast cancer targets those cells, those receptors. However, with triple negative, those three are absent. That's why it's called triple negative. So there are no estrogen receptors, there are no progesterone receptors, and the HER that normally should be overexpressed in women with breast cancer is underexpressed. What that then means is, what are you treating?
Okay.
What is the target for the drugs? That is why the prognosis is very
confusing.
Yeah, exactly. That's why women with triple negative are very highly likely to not survive beyond 5 years.
Oh,
but medical advance is getting better, and women are surviving. I think the watchword here is awareness and early diagnosis, especially if it is not triple negative. If you know that breast cancer exists, if you know that breast cancer can happen to anyone, if you know that breast cancer doesn't depend on age, it's not dependent on how good or bad you are in life, it's not dependent on anything you've done or, not done. It's important that we know that this exists. So if you catch it early, then possibly you'd be able to prevent it before it gets to the stage 4. But also with triple negative, if you're able to do regular screening, then it would prevent triple negative being discovered at very late stages. So yeah.
Okay, we've got a caller from Jamai. Hi, Monica.
Hi, good morning.
Good morning. Thanks for calling us. Please, if you've got a question or a comment, go on.
Actually, I have, should I say a problem or a question? Let me put it that way.
Kindly go on.
I'm actually breastfeeding.
Okay.
I have a barely 3 months baby that I'm breastfeeding, but for the past 3 weeks, I started feeling some things in my right breast. Whenever she starts to suck or whenever she is breastfeeding, I feel the things. So I thought maybe it's one of those things in breastfeeding. But later I found out that on should I say the teeth of my breast, there are some kind of these dotted, well, should I say pointed things on the teeth of our breast. One of them, I saw, should I say water also, a fluid on it, on one of the dotted point on the teeth. And then I had a midwife who is my friend. So she said, oh, it's nothing will happen. So she helped me with a pin, or let me say blade. Then we cut points of it, and then the fluid came out. Just tiny. You wouldn't even see there's a fluid, but whenever I just take out my breast, I see that there's a fluid in it. Just very tiny, very small. You wouldn't even see.
Okay.
So it went out, and then I saw nothing. For a week, it started again. Whenever she starts, I feel much pains from my breast. She finished after sucking, maybe within first 5 hours or 6 hours, I would just be feeling the pains like that. It will just, sharp pains will just come and then move, come and then go away, come and then go away. So I don't know what the problem is.
Okay.
It's not leaking as well. It's not leaking as the doctor said right there. It's not leaking. So I just feel a sharp pain within it after she sucks or after she breastfeeds.
Okay.
Well, I've got the breastfeeding and after the breastfeeding.
I've got a question before I pass you over to Mputu anyway.
Okay.
But are you producing enough breast milk for the baby? Normal quantity?
Yes. Yeah, not really enough. After I delivered her, within 4 days, I was not getting a breast milk for her, so I was actually told to give her something. Give her formula, which I did. But afterwards, the breast milk started coming. But to me, I don't think it's really satisfying her or coming as it's supposed to be. Even though she gets some to start doing, but not like I want. Yeah.
Okay, Monica, I can hear her giggling in the background anyway. Thank you for calling. I'll take Mputu's comments on that. Yeah, what could that be? And please do want to link breast cancer to breastfeeding if there's any link.
So research has shown that, again, it's not very straightforward as most things with cancers are. Yeah. But research has shown that women who breastfeed, especially women who've had children before 30, like I said, and breastfeed their children, may not be as prone as other women to having breast cancer. But again, it is one of those risk factors or non-risk factors that could be, couldn't be. But it's just from statistics. But to tie to what you've said, Monica, I think that with pregnancy and giving birth and breastfeeding, there's a lot of hormonal changes. So this may just be one of those ones that may not be something to be concerned about.
Okay.
But when it comes to do with the breast and breast cancer and related issues, you can never be too sure.
So a woman who's breastfeeding, can they still do the self-examination?
When you're breastfeeding, it's tricky. But I mean, it wouldn't be hard to to understand that you have an unusual lump even if you're breastfeeding, for example.
I think that, Monica, it's not enough having consulting with your midwife friend. I think you still have to take
exactly. I was just going to say that because I would say follow your gut instinct, because it feels like you are not convinced that it's nothing. Yeah. And usually, sadly, some things that start with it's nothing usually
become something.
Exactly.
Yeah. And to take me to, so is this treatable or is managed? I know cancers, it's hard to use the word treatment for them. So would you say that we can treat breast cancer or we can manage it? But whilst you're at that, I've just got this quick announcement for you. And so a little later on Joy Prime at 10 a.m. today, we'll be telecasting the 2021 Ghana Teacher Prize Award here. It's on Joy Prime today at 10 a.m. You do not want to miss it. We'll bring you the live coverage here. Exactly here at 10 a.m. Okay, so right after Prime Morning, you do stay, and at 10:30 you get to watch that one. Okay, right. So did I lose my thoughts?
No, you didn't. So it was about whether breast cancer is treatable.
Yes, it's a treatable or manageable. Yeah.
With breast cancer, it's not. You can't exactly say it can be treated. I think that if you understand what it is and what we are targeting, then you'd understand how that works. So because it's hormonal, a lot of the times you never understand where it will express itself. But also depending on what stage it is. So if breast cancer has already metastasized, like I said, to, let's say, the liver, for example, or it's hiding in lymph nodes, it's really hard. Sometimes they take out a few lymph nodes to try and prevent it, but it spreads to other places. And sometimes it's in places that they can see, but they can't touch. So it's really tricky with that one. And that's why we always say, get to check it early. So catching it early is the catchphrase. Okay.
Yeah. Apart from you getting the self, checking yourself at home and all of that, if you walk to the hospital, what typically are you looking to do at the hospital? What will the health person do for the screening? What do you look out for?
Usually they do mammograms, so they help you check in the hospital.
What's a mammogram?
So it's like essentially just checking your breast with a machine.
Okay.
Is the best way to explain it, and just looking for certain signs that they would know are not typical. Okay. But also you could do screening. So some people want to understand, do I have a gene that predisposes me to breast cancer? Okay. So your doctor could recommend you for screening. But what I would say is, if you have any female in your family at all that's had breast cancer before, you should ask your doctor to refer you to a genetic counselor, who will then talk you through your risk of breast cancer as someone with a female relative who's already had breast cancer.
Heard that? Yeah, you have my full attention on that. I hope that I got your full attention on that. I'll come back for your final words, but that's a quick one again. So Joy Prime brings you live coverage of the 2021 Ghana Teacher Prize Tuesday here, October 5th at 10 a.m. The theme, Teachers Wanted, Reclaiming Teaching and Learning for Human-Centered Recovery, will honor some outstanding teachers who have exhibited exemplary leadership and groundbreaking work that has impacted and transformed the lives of students. President Nana Akufo-Addo is the guest of honor for the 2021 Teacher Prize. So kindly look out for that one at 10:30 right here on Joy Prime. In Ponto Pius, I'll take your final words. I see that you're co-founder of Biomasses. What is that? Biomasses.
Yeah. So Biomasses is a startup. We're focused on women's health. So essentially, we're producing a device, a novel device for pregnant women to be able to monitor their risk of things like miscarriages and preterm birth. So currently, we understand that most of those kind of disease conditions are not exactly a disease condition, but conditions related to pregnancies are only diagnosed after the fact. They're only detected after it's happened. So what we are going for is preemptive diagnosis, or at least preemptive detection. And so that's what Biomasses is about. But just beyond women's health, we are looking to create a healthcare ecosystem for Africa, where we can domesticate advanced technologies for like effective monitoring of health records, effective monitoring of anything health in Africa.
Okay, do you practice your medical genetics here in Ghana?
Oh, no, I don't. I practice in the UK.
Oh, my God. Do we have a lot of them in Ghana here? No, we don't. And so definitely grab a box of pizza for yourself, a cheesy pizza today. Affordable, yummy, tasty. A cheesy pizza will bring you the yummiest, the yummy. Grab one and then look out for the 10 a.m. live coverage of the Prize Teacher Awards here on Prime Morning. My name is Emefa Akosua Adeti. I've been speaking to Mponto Pius. Thank you so much. It's been a pleasure. We learned a lot. Please, let's keep creating awareness on breast cancer. It's Pink October. Do have a good one today.